Herzlich willkommen zu Blickwinkel, der Expertentalk in der Ophthalmologie von Bausch und Lomb. Hier beleuchten wir die Themen, die die Augenheilkunde bewegen. Wir wollen Visionen teilen, Ansichten kritisch hinterfragen und Expertenrat zu aktuellen Themen hören. In dieser Podcast-Episode widmen wir uns dem Thema Patient Flow in Cataract Surgery – Standards versus Individualization. Wie es der Titel bereits verrät, haben wir dieses Mal einen internationalen Gast bei uns. Dr. Florian Kretz im Talk mit Professor Jonathan Moore, Clinical Director der Cathedral Eye Clinic in Belfast, Nordirland. Gemeinsam sprechen sie über Möglichkeiten, den Patientenfluss im eigenen OP durch Standards zu optimieren, welche Rolle Mitarbeiter und bestimmte Werkzeuge dabei spielen und die Notwendigkeit, sich und das eigene Tun immer wieder zu hinterfragen.
Augen zu und reinhören. Herzlich willkommen bei Blickwinkel, dem Expertentalk der Ophthalmologie von Bausch und Lomb. Wir haben heute einen ganz besonderen Gast, und zwar haben wir heute unseren ersten International Talk. And I welcome Professor Jonathan Moore from Belfast. And it's a pleasure for me having you here today, Johnny.
Well, it's lovely to be here and thank you very much for the invite.
And we will straight away start. Is there a perfect patient flow within cataract surgery, or does every cataract surgeon need to find her own way? What's your opinion on it?
That's an interesting question, Florian. I think there are general principles which are key to every surgical flow to ensure its efficiency. Obviously, the circumstances that one is in, principally the theaters, the space, etc., will dictate to some extent the flow and the nuances of how one sets up the flow. But I think that the key principles are the proper organization and planning of the flow, being here certainly was one of the reasons why I came to you, Florian, was because obviously you're renowned for running a very efficient setup, and it was a really super experience today to watch and to be honest, take notes on the parts of it that I can see that certainly I can improve in my own flow back home in Belfast, and also combine it with maybe some of the things which I think, I like that I'm doing in my own practice. But yes, individualization is certainly, something that is good in every theater. But I think what I feel is that there are standard sort of protocols and systems that can be put in place and which are pretty much universal.
I can only fully agree with you. But I do believe that you have to adapt each flow to the location you're working at, and that walkways play a very important role. And then you need to set your standard, and I think the individual surgeon, it's more about the surgical technique and the instruments, but beforehand you always have to predefine what's the best way to actually optimize that patient flow and the walkways patients and doctors and also nurses and other staff are walking through to make it more efficient. If we go back into defining it to actually set standards, what does patient flow mean to you in your routine?
Well, patient flow really is the aspect of consideration of when a patient enters into your clinic to when they leave again. And every aspect of that movement of that patient through your clinic. And obviously that can be just in an outpatient flow, but obviously today we were really focusing on the theater. And I mean, certainly to the private clinics and even to government clinics, when you have a large team which is in a theater, it's a very costly place. And it's the one place where it becomes critical to make it that as efficient as possible, but also combined with that it's as safe as possible. And those are the aspects that, when you're it's unusual for a surgeon to stand when you're used to operating so much, but to stand and really sort of look and consider the aspects of the flow which is taking place in your colleagues, which was what I was looking at in your theatre today, and really to try to take that and consider how will this fit into my whole setup at home. And there are problems. I think everyone faces problems to try to make that as efficient as possible, because there's a large team, and in that large team, there are disparate ideas, and there may be regulatory aspects which you come up against. But I think if you're starting with the premise of looking at every single aspect of it from both a safety point of view and an efficiency point of view, it is possible to improve both those aspects.
That's absolutely right. And I do think, you have to divide a little bit between the patient journey and the patient flow, because you always have to consider what's the experience of the patient when he basically goes through your workflow, that they don't feel they're just a number, and that they still feel they get individual care, but also that they realize that there's a high degree of standardization behind it, making it safer for them and also more efficient and reducing their waiting time.
Yes, I mean, I fully agree with that. And that was something I was looking at and thinking, these patients are going through very quickly. And I mean, a lot of these are very bright, intelligent, and, of different, some of them, if not all of them, were private patients paying a lot of money for their surgery. And I was thinking to myself, are they getting the experience that is something which they are going to be very happy with because of the speed of the flow? But it became obvious, and I similarly do the same, is that the surgery that a surgeon is carrying out should be really what he's focused upon during that time in theatre. And then the organisation around that really requires all those members of your clinic that the patient is going to meet, ensuring that the experience of the patient afterwards, before and afterwards, is optimal. And I think above all, if something is run very efficiently and patients aren't spending loads and loads of time waiting, that's probably one of the biggest complaints that ever faces any clinic, and that patients really notice the most. Because one, they're fearful. They're in there, they're sitting with too much to think about. They've got this sort of operation coming up. And so being able to get through something as efficiently as possible and be treated both kindly and nicely through that, I mean, it will really enhance their experience.
Yeah, and I believe that especially the direct care after the surgery from the nurses or from the staff who's taking care plays an even bigger role, because that's what the patient really remembers. The surgeries goes quite quick for them, and they're just happy to be out. Most of them say, "Oh, we're already done." But having somebody after that, like, explain them how it goes on now, that is what really calms them and makes them happy about their whole experience. In your opinion, what are the main stakeholders when it is about defining patient flow and making it more efficient?
Well, my feeling is it comes down to the theatre staff, both the staff preparing the patient to go into theatre, and then the theatre staff. That's what's going to allow those patients to both be prepared for theatre and get through theatre as quickly and as efficiently as possible. I mean, depending on what facilities one has for waiting afterwards, that the time to discharge can vary somewhat and still have an exceptionally efficient throughput of your theatres, as long as you have enough space at the other side. But the key point is ensuring the patients are properly prepared, and then that movement through theatre. Obviously, there's the anaesthetic aspect, and whether that's going to be topical or whether it's a block or these sort of things. So that's another component which is included. I include really in the whole theatre staff.
Werbung. Hi, hier ist Robert, Marketingleiter von Bausch + Lomb Surgical. Ob du am Anfang deiner chirurgischen Laufbahn stehst oder bereits mittendrin bist, 2024 bringt das Fortbildungshighlight für dich. Vom 9. bis 11. Mai veranstalten wir in Frankfurt das Ophthalmologische Symposium, liebevoll OSI genannt. Freue dich auf den praxisnahen Austausch mit über 20 Referentinnen und Referenten aus den Bereichen der Katarakt, Glaukom, refraktiven und Netzhautchirurgie. Fortbildung war noch nie so abwechslungsreich, interaktiv und authentisch. Klingt spannend? Überzeuge dich selbst und sichere dir jetzt deinen Platz für das OSI 2024. Alle Anmeldeinfos findest du in den Shownotes oder auf www.bausch-lomb.de/osy. Wir sehen uns! Werbung Ende.
So when it goes about patient flow and handling patient flow, where do you see the biggest opportunity for yourself to manage it or to make it more efficient for your practice, but also more efficient and more safer for your patient?
Yeah. Well, the things that I noticed, and this is something I face in theatre, is quite often there's discussions and has with myself about lens choices, and there are particular things which we have included and are usual in that you have breaks, and I consider where you're going through a checklist. And I've personally, this is often very much a nurse-driven aspect, which to some extent I'm in agreement with, but it's every aspect of things which happen in theatre beyond the actual surgery, I feel, for a surgeon, has the potential just to expand that the time that's taking place there and reduce your efficiency. Because every conversation has the potential to create another conversation, which just takes away the focus on what a surgeon's there to do. And also, breaks his concentration of actually operating. If you're a quick surgeon, the thing about a quick surgeon is that it tends to be efficient, but also tends to be very safe. But when you're in theatre, the way to make that efficient is to reduce those side conversations, which can inevitably both take your concentration away from what you're doing and also just take time. One of the things I noticed that I liked today was the fact that the trolleys were being brought in and out, and after surgery, the surgeon, other than saying a cursory pleasantries to the patient after the operation, telling them that everything had gone well, was that the patient was removed and another brought in. So that reduced this whole aspect of the delay of a patient getting off and on a trolley, of the conversations that might go with that, and whether they're feeling faint or whether the difficulty in getting up off the trolley. So that was something I really liked, and I don't have the actual room to store as many trolleys as were here, but certainly having the secondary theatre beside me and getting that up and running so that I can walk from one theatre to the other was what I've managed to persuade my nurses to really push towards when I get back home again.
No, I can only fully agree. I have to say the best thing is you don't get interrupted. And the best thing is you only have to focus on your patient and what you're doing. Not to go outside, not to have to check emails, not to have anybody coming in asking you questions that are unrelated to the cases you're dealing with, and to have everything prepared beforehand. And that type of standardization and that type of planning really gives you the possibility to just focus on the cases and on the surgery, and not having your mind drift away to think, oh, I need to do this, I need to do that, I need to talk to this person, or I need to solve this. So I think that is very important that as a surgeon that you are able to focus on your cases and on your surgical skills, and not get your attention driven away all the time by other conversations or by other stuff. Johnny, which, if any, specialties do you see when it comes to cataract surgery from a patient flow point of view? So is there anything else beside cataract surgery that you think you can really enhance patient flow and standardize?
Yes, that's something I hadn't really thought about. Are you meaning inside theatre, or as in a theatre flow, or are you talking about other
in
aspects
general,
of you?
Can be in theater, can be in like the patient journey, patient flow in the practice beforehand.
Well, I mean, from my point of view, and this again relates, I suppose, back to cataract surgery or refractive surgery. We have a multidisciplinary team involved in pre-assessment for patients, and certainly the difficulty for me has been the fact of just clinic space and clinic time to see all these patients. Now we have the optometrists well trained, but they probably could be taking on more responsibility than they currently are. It has sort of been the general thing to revert to myself for making any decisions and all decisions, and even the aspects of the counselling of the patient as part of the consent process has come back to some degree, or at least a significant degree, to myself. Now, this has the difficulty of producing just a block there in the number of patients that I can see, unless I'm prepared to sort of work kind of 15-hour days, 6 days a week to achieve this. So, I mean, my visit here is again, I mean, I've realized some things had to be done by that. We have had a couple of trials of doing virtual clinic assessments, which actually went very well. But again, it's the institution and driving this forward into actually just standard operating procedures. Which, I'm very impressed with, Florian, how you do things here and how you really have focused on the systemization of what you do, and using a multidisciplinary team where they're well trained, but then you empower them to do these things, and actually it becomes that is their job, to do them in a way that it increases the efficiency of the whole clinic. And reduces the requirement for your input in every aspect of the actual clinic.
Well, I think it's really important that you set out SOPs, because that is a guideline for all of them. But with giving them SOPs, you can also give them the possibility to learn new skills and develop themselves. And with development, there's always responsibility that comes with it. So I think it's really important when you train someone that they also learn and understand that it comes with a responsibility that they have later on, and they have to make their own choices. They can still always ask questions in complicated situations, but in some ways they have to develop until the end, where hopefully they are that far that they can really make all choices on their own. And that's something that we really try to push here a lot, to train the people, to give them space to develop, to back them up, and then later to make choices, but also later to train others. So this whole concept of to see something, to do something, and to teach someone else, I do believe, at least in our field, is very important for their own development and for their own like time management, and also especially to continuously optimize patient flow, because it's not something that is set in stone and will never change. It's always something that's kind of in a flow, and that has to be further developed depending on the technology, availability, and also different procedures. Like we have really standardized SOPs for intravitreal injections, for even more for refractive surgery, to being efficient, but also to basically having comparable outcomes and good outcomes later on.
Yeah, I mean, I can certainly see the key point in increasing the ability of all your staff in the workflows, and empowering them, and also that from that education and that whole sort of process, their whole enjoyment of their job will increase as well. But it does then, you make that point that as a discipline, certainly ophthalmology must be one of the quickest changing disciplines out there with new technology being brought to bear all the time. So if you have created a workforce that's used to change and used to increasing their knowledge and education and constantly striving to do that, then that allows you to keep on improving and keep ahead of, I suppose, your competitors, and also just even at the top of your field.
Yeah, definitely. So maybe you can help me to define something new. Often people think when something becomes fast, then it becomes dangerous or more risky. And then there's often this question, what is the real focus? Is it the well-being of the patient, or is it the efficiency? And I have to say, from my own experience, being efficient and increasing efficiency also increases safety, because you set standards, and those standards also include how you proceed if complications happen. And the speed is just something that basically comes by the side by becoming safer and more efficient. Or what's your point of view on that?
No, I'd fully agree with you on that. I mean, I've had the same things level, on my sort of country as well, and geography on the at times, and this concept that if things are going too quickly, or if you're too efficient, that it's just being done for financial reasons, etc. And actually, financial reasons are very important, because as I made the point early on, a surgical team in a theatre is the most expensive part of your hospital, because there are so many people there, all there to support you in that one task of operating. But firstly, I would just make the very simple point. It's impossible to do 20, 30 cataracts in a morning or an afternoon and be having complications. You just can't do that and have complications. So that by itself defines that this is very safe surgery that's being done, because it is being done quickly. But the point, and we've kind of made this over and over again, is the whole systemization of it, and being careful to define every aspect of that process, so that every person in the theatre and outside the theatre and that supports the theatre knows exactly their job. Firstly, that's required to allow you to do the large numbers, but by the very fact that you're able to do the large numbers, you're definitely increasing the safety, because you're not leaving everything to sort of the choice of someone there and then to do or not to do. Everybody knows beforehand what they have to do. Otherwise, you can't be efficient.
If we're talking about the definition of it, usually what you try to do is you try to measure how something improves. But I find it sometimes very difficult to measure improvement, especially in patient flow, because even you become more efficient, you have more cases. What do you think could be a parameter to look at that gives you a more overall view on safety, amount of patients by time, to really see, okay, what's the improvement of my team, of my own patient flow, to benchmark yourself?
We've sort of alluded to various different points of what can be, we're trying to some extent define quality, which was exceptionally hard to define, because it's about both safety to the patient. It's about how well the patients have been managed through it, and therefore how happy they are with it, which is exceptionally hard to measure. And then it's about lack of complications, which is easier to measure because you record the complications, and over time in numbers you can compare that against other types of audit figures, which are published figures. And then overall, then there's other aspects of measurement afterwards. It's one might define the quality of your surgery, and or the quality of some aspects of the preparation for surgery, such as the biometry, the lens par choices. What are the post-operative errors in biometry, and these are all different little aspects which overall contribute to having both happy patients, but more importantly, having a lack of complications, a lack of requirement to enhance your surgery or go back to surgery or deal with either surgical complications or even wrong IOL choices, or if not wrong IOL choices, which result in unexpected refractive outcomes.
Yeah, I think really that is like the key, to look at multiple factors to really define improvement over a longer period of time. It's nothing you can do quickly. When you improve your patient flow, is it mainly you setting the standards, or is it more like a team effort and you take feedback from patients, from staff into account to make the workflow better?
Well, I mean, coming over here, I brought 3 important members of staff. I brought an overall, the sort of clinic manager, and then I brought 2 senior members, the theatre manager, and then a senior member of staff from that. Because, I mean, what I realize in all these things, if you can show the staff a place where someone is running it very efficiently, like you are, Florian, it'll actually enthuse them. I mean, I try and I've tried to sort of push in different parts to try to get efficiencies. And sometimes you can meet difficulties because people will sort of say, well, is that, again, you make the very point, is it safe to be trying to do this? Is it safe to be trying to put through these sorts of numbers? And this is the sort of kind of mindset, which maybe is not necessarily a bad mindset. It's really important to consider the safety as paramount and as the first thing. But it's really letting people understand that it is possible, and then bringing them on board with the concepts and to enthuse them. And our aim is to go back home. And really, next week is to sit down, have a day out from the clinic, and really go through everything and write down and sort of say, look, how do we bring some of Florian's systems to bear into our clinic, and how do we sort of directly in our own particular place integrate any new things, and maybe just introduce things in general that are sparked, ideas that have been sparked from being here, and to try to create a proper workflow that will assist us to increase our current efficiencies. Not just for myself, but for a lot of the other surgeons that also work in my clinic.
Well, I remember when we started optimizing the patient flow in the OR, we actually printed out plans of the OR on large scale, put them on a big flow chart, and then we marked, okay, where is who standing, and what are the ideal walkways for the surgeon, for the nurses, for the anesthesia staff, the patient beds, how do they need to move so that they're not standing in each other's way. And that was like the first step we took, and we are having audits like every 3 to 4 months where we really try, okay, what else can we look at? Is it the biometry? Is it the digitalization we have to look at to enhance our patient flow? Or do we also have to like reconsider our walkways, reconsider how we prepare stuff? Sometimes it's just that you have to store different materials in different spaces to access them easier when you need them. So there's a lot of different things going into, and I really think it's important that you have your staff on board and you can talk to them, and you also listen to their advice and ask them, okay, what do we need? Where does it need to be? How can we make it more efficient and more safer for the patient?
Can I ask you, Florian, obviously, as I find in most theatres, if you're going to try to push forward to increase efficiency, people end up having to work harder. And do you find that is, how have you managed to achieve that, really? Because there's a human tendency that it's easier to go in a more relaxed way than it is to go really quickly. How have you managed to go over, say inertia in some of your staff? How have you gone about that?
I think what was a very important part is that every day when I come, I greet them, and when I leave, I greet them, and I do say thank you. And that is something that I had to learn in the beginning, that was a very crucial step that I did forget in the past. And it has developed into more that everyone in the OR team wants to give their best and they want to improve themselves. It's not about speed, and it's not about being fast or about being efficient. They want that the patient have the best possible experience, and they are continuously driven to develop themselves. And that's something that you can best support actually outside the OR. So I do talk to them on a regular basis. I ask them if there's anything else that we can do better. I try to take their feedback into account. But I also tell them if I don't think that the feedback is good, we can try it. And if it doesn't work, I will tell them, we tried it, but it didn't work. So we try something different now. And to motivate them and making them a part of the whole process. And also showing them that you appreciate what they are doing and giving them the space to develop, also is giving them new jobs and sometimes more complicated jobs, I think is what is really important to overcome that. They need to step out of their normal way where they just walk straight and they don't look left and right. And once when they learn that there is a left and right and there is up and down and that you can consider different approaches, they start to have fun. And when they start to have fun and when they start to be proud of their work and what they achieve, then they really help you and support your efficiency.
Yeah, I mean, I think I would totally concur with you. I mean, people need to be appreciated everywhere. And I think certainly owning your own clinic and having it is possible to really show your staff that you appreciate them, and that when they do try and they are moving forwards, that everybody can get a bit of a kick out of it. It is a good thing.
Yeah, for example, I take them to conferences. Even their ophthalmologist conferences, like I took my 2 head nurses to the ESCRS last year, and they enjoy it because they see something different, they get a different perspective, and both of them came back and said, we saw this and that, maybe here's something we can optimize. And usually the ideas are great, and I do believe that those little things that don't cost a lot is really what gives them the motivation to go a little bit further and try to become even better.
Yeah, that's great.
Is there a tool that you use to optimize your patient flow or to measure your patient flow in daily routine, or a tool that you want to use in the future?
Yeah, well, the one tool that I'm very keen to integrate with is Forum, the EQ system, because that will, I just see that the ability to be able to organize the lenses, organize all the lens ordering, the lens pars, and have the flexibility to do that in multiple places and outside of work is really will give us the option to both have me critique them, even if I have core members of optometry staff who do this, that allows me to critique what they've done and allows them to ask me for advice. I mean, that's something that we're just in the process of getting. In fact, we'd hoped we would have had it in place before Christmas, but we've just been held up from some aspects of computer aspects. So that's one thing. The other, we sort of created our own online sort of ability to easily assess all our refractive outcomes. We sort of created that ourselves based on a Salesforce platform. So we can do all our standardized refractive graphs, and it allows us to look at all our post-op data very easily and assess it for each surgeon. And then we also get automatic optimization of our A constants. So that's something that we just created ourselves in the clinic, and it's something I've had in place now for the past few months, which is working really well. And it's great because if you're publishing as well, it's designed so you can just put it straight into publication.
Yeah, like those systems are really important, and I think they're there is like a lot in this field of digitalization, connectivity, that can be done in the future to enhance efficiency and make patient flow better and even make the patient experience better. I have one last question as we're coming to the end, Johnny. Which tool would you not recommend or you made bad experiences with regarding patient flow?
Well, it's not something that I have used as yet, but it's something that I wasn't particularly caught with using, was the femtosecond laser for cataract surgery. I mean, I've looked at this and I've looked at different colleagues and I've go to see different people using it. Now, as it's gone along, and some colleagues have kind of convinced me that there are benefits from it, and there's certainly the regularization of the capsular axis and these sorts of things. But every time I look at it, and see it in somebody's theater, I'm just of the consideration that, certainly it can be beneficial to maybe the more junior surgeons. But if you're a high throughput surgeon, I just have the feeling that it slows the process down. And I'm not convinced as yet that it improves the quality of outcome, but I'm still open to be persuaded.
Oh, as you know, I do have several femtosecond lasers, and I'm very happy femtosecond laser user. When you were there today, I actually did two cases.
I saw you using them. Yeah.
So I do believe that it does increase the safety for the patient. Yes, it does slow you down a little bit because it is the extra 2 minutes that you need to invest. But I do believe it gives you a great degree of repeatability. You can be the best surgeon in the world. That laser will make the capsular axis in the same way it does it every time. And I do believe that is something that patients can benefit from. Maybe not on a large scale, like in a 2-digit percentage, but definitely in like a smaller scale. And I do believe, especially when it's about purely private patients or premium lens patients, that can be one of the options that you have to make the slightly better outcome or give them the slightly more security that they need to get a good outcome and to be happy with their surgery.
Well, I mean, I'm going into an expansion phase myself of a new clinic, which will be moving into in the next year. So usually when I go into a new clinic, I look for another fancy tool, something that I think can genuinely help and improve the care for my patients. So can I ask you, would you recommend then, is this something to invest in?
I do believe that on the one thing is patients like lasers. So just from the marketing aspect, it is something that patients actively ask for. And it is a technology that patients believe in. Because even if you look in the car industry or metal welding, the laser version is better than the manual one. Because it just gives it a little bit more of repeatability. But it still needs an experienced surgeon to operate it. And when you look at studies and you see like, the outcome with the laser is not better with manual. Yes, sure. Because if you give 10 people a laser and you give them the same phaco machine with the same settings, why should the outcome be different? You need to optimize everything on your workflow. And the workflow is slightly different using a laser than it is doing it manually. So I do believe investing in a laser is something that's worth investing in. It's a marketing tool, but it definitely has its pros. Patients like lasers and the repeatability is better. And I do believe if you start optimizing your other workflow parameters like your phaco machine, your vacuum in the phaco, your bottle height, then you will realize a difference between cases that were performed with the femtosecond laser and that were performed purely manual.
What about some of the new lenses that are really only usable in where you've got repeatability with the Rexus? Those are designed for use with the femtosecond laser. I mean, would you recommend those as some advantages or not over the standard within the bag lenses?
I do believe they will have their advantages in the future when optics become more complex. And we are on the step where basically each one of us is dreaming that we produce the lens individually for the patients in the eye, and it gets 3D printed, and you put it in the eye. I don't think that we are too far away from that individualization. Maybe not having it in your own facility, but maybe getting coma, spherical aberration, all different parameters adapted in a lens. And then the only crucial part is going to be the fixation and the effective lens position and a possible tilt or decentration. And that we can only handle if we use the capsulotomy as the point of fixation and not the capsular bag, because that area is just even smaller. So it will be even easier later to place a lens exactly where you want to place it to correct for the small errors that are in a micrometer range.
Okay, interesting.
Johnny, thank you very much. It was really great having you today.
Oh, well, thank you once again for inviting me. And I genuinely really, really enjoyed it. And it was, a real learning experience for me.
Und jetzt können alle wieder die Augen aufmachen und wir freuen uns auf die nächste Folge von Blickwinkel, der Expertentalk der Ophthalmologie von Bausch & Lomb.
Vielen Dank fürs Reinhören. Empfehlen Sie uns gerne weiter. Und um keine Folge mehr zu verpassen, nutzen Sie die kostenlose Abonnierfunktion unseres Podcasts. Wir freuen uns auch über Ihr Feedback. Welche Expertinnen und Experten sollen zu Wort kommen? Möchten Sie selbst vielleicht auch ans Gastmikrofon? Oder welche Themen braucht es unbedingt im Blickwinkel-Podcast? Dann schreiben Sie uns eine E-Mail an die Adresse blickwinkel@bausch.com. Bis zur nächsten Folge von Blickwinkel, der Expertentalk in der Ophthalmologie von Bausch & Lomb.